Mutation in HFM1 in recessive primary ovarian failure. Definition: it occurs when the ovarian stops working before the woman turning 4 years old. The IOP causes the ovaries don't produce normal amount of estrogen and not producing and releasing an egg in each month.
Premature ovarian failure, by definition, is when the ovaries pack up before the age of 40.
The average age of menopause is 51. 85% of women have gone through menopause by the time they're 53. There was still 1 or 2, maybe less than 5%, who have a late menopause at 55, 56. So there's an age range. It's not uncommon to be late in the 50s or early in the 40s. I wouldn't be surprised if someone had an early menopause. It would be early, before 45, but it's not premature. By definition, premature is really not meant to happen. That's before the age of 40. And I've got some women 28, 31 who are menopausal, some women in their early 20s. Now, usually, these are problems that we've created. They may have had a cancer that needed treatment. I've got a lot of leukemics who've had bone marrow transplants, immunosuppression, whose ovaries are packed up. Or they've had to have their ovaries removed because of ovarian cancer, or they've had breast cancer, and there's been a deliberate attempt to shut the ovaries down. You can't give them any treatment, they've got syphilis, you've got to do something else for them. So there are women who developed premature ovarian failure secondary to the treatment that they badly needed. It can be genetic, linked to fragile X syndrome. That's quite uncommon, but there are some women genetically predisposed to their ovaries packing up early. It might be secondary to severe pelvic infection. Pelvic TB might eat the ovaries away, and then there's no ovary left to produce estrogen. So there are many different reasons for premature ovarian failure, but if you're in your late 20s or early 30s, you are facing 20 to 25 years without estrogen before your peer group. You know, the average age of menopause is 51. You're going to have oats of a 60-year-old before you're 35. So these women are facing long-term health issues. Now, there have been 2 good studies that have come out from the Mayo Clinic in America and from Imperial College London last year. And both these studies, for the first time, have looked at the long-term health effects of not treating women with premature ovarian failure.
Implication in medicine. Treatment depends on whether you have symptoms or are at risk for serious health problems. Hormone therapy is the most common treatment. Diseases. Because women with ovarian failure have a low level of estrogen at an early age, there are several conditions that are more common in them than in women without the disease: infertility, osteoporosis, heart disease, and depression.
The testicles of adult men produce about 500 million sperm each day. By contrast, women generally release only 1 egg per month. In order for fertilization and conception to occur, one of a man's many sperm must join the single egg release in a woman's oviduct or fallopian tube. There are many causes of infertility, and oftentimes the reason for a couple's inability to conceive is never determined. Some known causes of infertility in men include low sperm count or non-functioning sperm. Infertility in women can be caused by many factors. Some known causes can include failure to ovulate or blocked fallopian tubes. Severe endometriosis, a disorder where pieces of the uterine lining stray and adhere to reproductive organs, is also a common cause of infertility in women. Diagnosis and management by physicians may be successful in treating some couples with infertility. Some cases of infertility can be treated with medications or surgery. A physician can also discuss alternatives to natural conception, such as donor sperm, donor egg, and adoption. Osteoporosis is a condition in which the density of the bones in the skeleton has reduced, making them weaker and prone to fracture. Globally, an estimated 9 million osteoporotic fractures occur each year. As life expectancy increases,
so too will the annual number of osteoporotic fractures. In fact, a fourfold rise is predicted over the next 5 decades. Osteoporotic fractures cause pain, suffering, disability, and sometimes deformity. Osteoporosis is most commonly seen in women, although men can also be affected. For instance, in a 50-year-old man in the UK, the lifetime risk of osteoporotic fracture is 3.1%. In a woman, the risk is 11.4%. This presentation will focus on postmenopausal osteoporosis. Bone provides support for movement and protection of the body's organs, acts as a reservoir of minerals such as calcium, and produces blood cells. It has two components. The outermost cortical bone is dense and compact. Below this is a spongy lattice-like trabecular bone. In the center, soft bone marrow, which produces blood cells, fills the holes and passageways of the bone. The combination of the dense compact cortical and supple trabecular components make bones both strong and light in weight. Bone is a living tissue. It is constantly in a state of renewal or repair.
Disadvantages. This disease causes night sweats, vaginal dryness, irritability, depression or anxiety, difficulty sleeping, difficulty concentrating and remembering. That's all. Thank you.